Hello everybody, we're going to finish up the muscular system anatomy here by going over the lower leg muscles. Alright, so we're going to zoom in down here on the lower leg, and I'm going to rotate around to the back side so that we can take a look at your calf muscles. Alright, let's zoom in. If I can get things positioned right. I never get these arrows right, they seem backwards to me for navigating around. All right, so if I highlight that muscle right there, that is called the gastrocnemius muscle. That is your superficial calf muscle. Let me rotate this around for a second because I want to show you that you have a deeper calf muscle, and that is called the soleus. So, and some people call those the soleus and the gastrocnemius together. We'll refer to those as a triceps suri group. And those muscles cooperate with each other. They are synergists. But the superficial one, which is a two-headed muscle that you see there, that's your gastrocnemius. That's what we typically call our calf muscle. And what does this muscle do? Let's turn our pins on. And the origin of the gastrocnemius will be up here, also over here on the other side. You can't see the other origin because it's obscured by some of the other muscles there in the along the thigh. So it's actually, the origin is on the femur, not the tibia. It's actually just above the condyles of the femur. That's the origin. So this muscle does cross the knee joint. Insertion point is down in here. It inserts into a large tendon, which we've all heard of before. This is the Achilles tendon, or it's also known as the calcaneal tendon because it connects into the calcaneus, your heel bone, down there. All right, so let's think about what's happening here. When this muscle contracts, stationary up here, above the knee, on that distal portion of the femur, pulls on this tendon. This tendon is connected down here to the heel. So what's going to happen? A couple of things are actually going to happen. This muscle can assist with knee flexion. Just think about it. If it's pulling back like this, you're going to have flexion of the knee. So the gastrocnemius assists with knee flexion in some situations. Another thing that it's doing, it's pulling on the heel. What's that going to do to the bottom of your foot? Your sole's going to go like this. And we said there was a special action term for that. That was called plantar flexion, because you are flexing the sole of the foot. That can also be called ankle extension. At times you're extending the ankle rather than flexing the ankle like that. But the best thing to learn is just there's a special action term. When you come up on your toes, that's called plantar flexion. Gastrocnemius is your main muscles for that. You use your gastrocnemius when you're jumping, coming up on the toes. You're running. When you're running, you come up on your toes. Jumping rope, those types of things. You guys know if you do those kinds of activities and you haven't done them for a while, your calves wind up getting sore. All right, and then the soleus muscle, let me hide the gastrocnemius for you. There's your soleus muscle, so it's deeper, and it has a tendon that it's connected to, and it's also connecting down here onto the calcaneus. And so it is a synergist to the gastrocnemius, and its main job is going to be plantar flexion. It's helping the gastrocnemius when you need to come up on your toes, bend your foot downward like that. All right, so that's those two. And then let's move on. Let me turn everybody back on. Let's see. Show. Everybody come back on there. There we go. Let's rotate around this side. On the anterior, next muscle is going to be the tibialis anterior muscle. All right, so you guys know where your tibias are. The name tells you where it is. It's on the anterior side of the lower leg, next to the tibia. So right there on the left, over here on the right. So if you find where the tibia is exposed, and you guys know that is your shin bone, right? You can tell the bone is very close to the surface of the skin there. And you go immediately lateral to that, so towards the outside. That's going to be your tibialis anterior muscle. And if we highlight that one, and let's turn our pins on, the origin is up here on the lateral side of the tibia, up there at the lateral condyle of the tibia, that curved area there. And insertion points, it's got a few of them. If we roll down here, insertion points down here on the foot. There are some, you can't see them because they're covered by those ligaments there. But you have some insertion points there on the top of the foot and over here on the medial side of the foot. When that muscle contracts, it's doing a couple of things. Dorsiflexion, so when you bend your foot upward like that, that's one thing. And then because it's also attaching over here on the medial side of the foot, when your foot does this, it turns inward. Remember that's called inversion of the foot, when you turn the sole that way. So if you imagine that tendon right there pulling in this direction on the bones of the foot, that's going to cause that inversion to take place. So that's what your tibialis anterior muscle does. All right, and then there's the last of your lower leg muscles that you need to be able to identify. Well, not the last ones. We got a few more after that, but the that are involved in flexion and extension down here at the ankle and the toes. But let's rotate around here on the lateral side. So the lateral side of the lower leg, running right down the middle of the lateral side, that is called the fibularis longus. It can also be called the peroneus longus. That's an alternative name for this. And you'll see fibularis or fibular can be interchanged with peroneus or peroneal. You'll see that with nerves and arteries and veins as well as you move through your A&P courses. So what's this one doing? All right, the origin is actually up here on the head of the fibula, on the lateral side up there near at the knee joint. And then it's inserted down here. See in yellow, it blends in with a tendon that runs along the lateral side of the foot and actually wraps around and on the underside of the foot. You can't see that because it's obscured by some of the muscles and tendons there on the bottom part of the foot. So what is that muscle doing for you? It's actually also helping out with plantar flexion because it's pulling. You imagine pulling on the side and bottom portion of the foot here. That's going to help do plantar flexion. And it's pulling on the side, so it is going to be involved with everting your foot, turning the foot to the outside. So whereas your tibialis anterior is involved with inversion of the foot, this one is everting the foot. All right, that's those four. And then remember how up in the arms we said we had flexor and extensor carpi muscles for the wrist? Well, along the lower leg, you have flexor and extensor digitorum muscles for your toes. Now, your ankles are being flexed and extended. That's plantar flexion and dorsiflexion, as we already talked about. All right, and you're not going to have to learn the individual names of the muscles, but let me scan upward for a second. All right, so earlier we were taking a look at, there's your tibialis anterior. It's right next to the tibia. And then over here we had the fibularis longus. It's running right down the middle lateral side of the lower leg, right along where you would find the fibula. And then in between the two, if you look right there, there's a muscle in between those. And that is actually your main extensor digitorum muscle. It's called the extensor digitorum longus. And you can just know that as an extensor digitorum muscle. That's fine. There are some other smaller ones around. Like that one right there is the extensor for the hallux, or your big toe. So you've got that one, and those are involved in extending the toe. So if you think about it, they're over here on the front side of the leg. And when you extend your toes, if your toes are curled like that, they're flexed, right? And so if you extend them, you're sticking them out straight like that. That's going to be extension of the digits down here at the feet. So if you follow, like there's your extensor digitorum longus muscle, and if you look closely, it is connecting to these tendons right there in yellow, right there, right there, and right there, and look what they're connected to. They're connected to the phalanges of the toes. So when that muscle contracts, it's going to pull out on your toes and cause them to extend. When that muscle contracts, it pulls on the big toe and makes it extend itself outward. All right, then if we keep rotating around, so we said that's your fibularis longus muscle. And if we keep rotating around again, now over here, there's your gastrocnemius, there's your soleus, and then see how in between your fibularis longus and the soleus, you have a flexor muscle. That's actually the flexor for the big toe. That's the flexor hallucis longus. And I think if we rotate around this way, so we're looking in on the medial side here, right in there, just behind the tibia, there's the flexor digitorum longus muscle. You can just know those as flexor digitorum muscles on the back side of the tibia. If I have an arrow and say what muscles on this side of the lower leg work the toes, you can just say those are flexor digitorum muscles, because think about what those are doing. I've got that one highlighted, and the tendons it's connected to in yellow here, the tendons, and in gray right in there, like right, some of those as well. There's another flexor digitorum muscle that's actually just right there on the sole of the foot only, and don't worry about that one. But what those muscles are doing, flexion, that they pull on the phalanges of the toes and make you curl your toes. So easy way to remember, if I'm pointing to the back side of the leg and I say what muscles, what deep muscles on this side of the leg work the toes, they're flexor digitorum muscles. And if we're over here on this side, what deeper muscles on this side of the lower leg work the toes, those are going to be extensor digitorum muscles on that side. All right, and that actually completes the muscular system anatomy. I'm going to make one more video where I'm going to use the regular visible body rather than this muscle premium version, and I'm just going to quickly click through all of the muscles that you need to know, just as a quick review without any additional explanation about actions or origins or insertions, and hopefully you'll be able to use that as kind of a quick reference if you just want to rapidly review. Alrighty, and that'll be the last one I'll make for you just to use as kind of a quick reference.